This is Innovation Connected, coming to you from the World Economic Forum in Davos, a podcast by Tenity.
My name is Max Planck. I'm a venture partner of Tenity, and welcome our esteemed guests, Safia, Agueni, and Michael Schelper. Welcome. Thank you for taking the time, and maybe you can all do a quick introduction about yourself. Maybe Safia, you do what is your current role, and also what was your path to innovation?
First of all, thank you, Max, for having me. It's really amazing to be here and at the WEF, sideline of the WEF, so thank you for the invitation. My name is Safia. I'm a health tech leader. Have worked mainly in the corporate world for many years, almost 19. The major pharma company in Switzerland. I've worked recently for 4 years in the personalized healthcare, which is a fascinating area. And I also have the pleasure to lead a non-profit organization named Women in Tech Switzerland, which is really driving efforts to empower more girls and women to embrace technology in Switzerland, but it's a global network.
Thank you. No, I think this is also how we met each other a couple of years ago on the first travel to the Middle East with that association.
Yes.
So makes it perfect to Michael. You live currently in the Middle East, and maybe you can do a quick intro about yourself as well.
Sure, absolutely. And thank you very much for having me in the podcast. It is wonderful weather in Davos for a change. So it's a pity that we're inside and not doing the podcast outside. I'm Michael Schelper, healthcare technology for the last 20 plus years. Long time also on the corporate side like Safia, but for the last 5 years more on the startup scale-up side. I'm currently with a Series C scale-up in surgery called Caresyntax, where we're trying to make surgery smarter, safer, more profitable, leveraging AI and other technologies. And then at the same time, also with a family office that is investing into health tech, because we really have to amplify the impact that a lot of the entrepreneurs can do in healthcare. And for that, you need risk capital.
Yes.
And thus, the more we can amplify that, the better it is for all of us.
Okay, wow. Maybe you can say something about healthcare, or what is let's say, the different verticals, because I was surprised myself when we talked about that, where is really revenue.
Well, the sad part when it comes to healthcare and innovation in healthcare is you really have to follow the money. And if we were to look at the two largest areas in healthcare, and that is where Safia spent a lot of time, which is pharma, by far the largest, rightly followed by surgery, which is about $1 trillion in the US in terms of spend, $1 trillion in Europe, and another $1 trillion in the rest of the world. Yeah. So these are the two largest profits pools that you do have in healthcare, and they are both very much prone for disruption, and where technology can really help to make it more effective, efficient, and lower the cost, but at the same time also improve how drugs are being developed. That is where AI is playing a big role. In our case, how surgeries are being performed, whether a surgery should actually be performed, and then really make them more profitable, more effective, efficient, better outcomes. Because we have a growing population around the world where that also not only a risk, but actually an impact on the health economics and the healthcare expenditure. So we have to somehow find efficiencies.
So the problem is mainly the cost?
Not only the cost, but there's much more. Safia, what's your take on that, if I may ask?
Well, I think you're right, Michael. I mean, we as pharma company, we play a huge role there. But I also see lately now the challenge that we come to the limits of funding those innovation as well as a corporate pharma, and also that we face this thing with AI not really delivering what the promises that we claim a few years ago. There are many reasons for that, but we are struggling, and I do think that pharma players will never make it alone, and they really need to learn how to collaborate more with the innovation stakeholders outside. So some are startups, some are also academia with the great work they're doing in the publication and the research. And also that I think with the rise of importance of taking a stand in the sustainability as a corporate player, it's also a sense of urgency now that they have to collaborate more to accelerate, for example, access to healthcare and health equity.
Yeah, but on the other hand, technically the pharmaceuticals have money at the moment, right? So you said there's technically also a funding issue. Where is that coming from?
Well, I think they have money. Well, I can only speak with a few companies I've worked with, not on behalf of all companies, and some are doing much better than others, of course. We know that, right? Based on the pipeline. But we come to the challenge where we have to make choices, and we have to make really like decision on the portfolio.
Yes.
And when you do that, you compromise on the innovation. And I've seen lots of effort on personalized medicine being sacrificed because it was not directly impacting the portfolio.
Yes.
So if we continue like this and driven by portfolio and basically blockbuster, that's not going to really meet the access to healthcare where we need to address. That's what I meant by we have limited funds, and then there's a conscious decision from those players where to put the money.
Okay.
And maybe just to add to that, Safia, one of the core challenges that we see, particularly in pharma, is to get a drug candidate to phase 1. Costs what, $500 million roughly? And then, you know what, there's a high risk involved, which also means back to your availability of funding, there are a lot of resources consumed with an extremely high risk profile. So you have a binary outcome to some degree. And that is where technology is really coming in to reduce that risk and provide still a pretty high sensitivity and specificity whether that particular candidate can get there. Innovative companies such as in silico medicine, for example, AI drug discovery platform is exactly doing that. And with that, you have the possibility to get many more candidates into the pipeline at a fraction of the cost what it's currently being required for one candidate. And hopefully with that, free up some funds for other innovations that duly needed but currently don't get the maybe priority.
Yes.
Okay. I mean, it's okay. I mean, what would you say are the current trends? I mean, where is currently the money flowing in? I mean, you talked about problems where money is maybe not going, but what do you see where really solutions are there which help? Maybe you can say something to that. Both of you, please. I see.
Well, I mean, we're talking about healthcare here, and where's the money going? Into sick care. Sorry for being a little bit provocative here, but that is really where the money is going. And as sad as it sounds, you have to follow the money flow in healthcare for any innovation to be adopted. And that brings it very swiftly to B2C approaches are struggling. And you have to focus on a B2B or B2B2C approach so that you can really ensure that there is value being created for the different players involved, right? From the providers over the payers, there are the pharma companies, and in the end, these are the ones that are paying to some degree and that want to also get return on their investment. And the end consumer, meaning all of us, are not necessarily the ones that can really move the needle. Which is sad because there are a lot of super important approaches and innovative approaches that directly could impact all of our health, life, and well-being. But due to the fact that it doesn't follow the money, they are struggling to even obtain the funding.
But isn't it a bit more complex? You also have regulation, then you have the longevity trend is also maybe not a sick care investment, but it's maybe in correlation a small one, right?
I'd like to build on what Michael mentioned, especially when we deep dive in the diagnosis area, because having worked in a big company, having a big entity in diagnosis and very present, I do think that's where I see the trend coming, because we need to catch those patients early on, not when they're already at the stage, a very late stage, especially in the oncology area. And this is where technology can help. But we have to understand it takes investment to build the infrastructure and capabilities. It takes also investment to have the right data, especially when you look at a very rare disease. I mean, it's hard to find those data. Knowing also that you need the diversity of data, scout for many different ethnicity and so on, for a very inclusive solution. So it takes a lot of those challenges to crack that. But that's the only way. And I think some company, they realize that they have to focus in this field of early diagnosis, and also in the field of finding, to your point, Michael, in the clinical trial, having more efficiency in the clinical trial. We now have AI capabilities which can help to stratify patients, high risk versus low risk. And then you do more efficient clinical trials. So this is for me a direction that needs to be taken both for patients to address unmet needs and also for efficiency and cost aspects.
And it needs to be coupled with a healthcare system that actually is focusing on that, right? So away from a revenue-driven healthcare delivery and towards proactive health and life management, where you do screening programs early on in order to catch exactly these diseases. And if you look again at the value creation or the interest of the different players involved, start maybe with insurance companies. Well, if you catch a disease at a late stage, most likely the cost implications are rather high.
Totally.
Depending on whether it's terminal or not, right? At one point in time, then the costs will disappear. But if you were to catch them early on, you actually can more effectively manage that. And this is what we need to do. So yes, it is still secure, but you're trying to catch it as early as possible. That being said, one thing that I think is very, very sad is we are typically basing our decision upon the 5 to 6 times on average that a human being interacts with a healthcare system for 20 minutes, which leaves out another 364 days and 23 hours where we are taking decisions that are impacting our health, life, well-being, and a lot of data points are being created. Clearly, we do not have the human capital or the human resources to review these data points.
Yes.
That is where technology comes in, and we have to connect the data points outside of the healthcare system with the data points inside of the healthcare system to really generate the insights that we need to then get more and more into the real healthcare space or proactive health and life management.
And why did it not happen yet? I mean, technically, we're talking about for a long time. This whole imaging part is there, right? There's a lot of, let's say, X-rays or MRI pictures available. There's also a diagnosis, so technically quite easy to train. There's enough research already in that space. Why is that not standard?
I can actually give you very specific example in the area of digital pathology. That's an area I've led program for some time in my previous role. And we faced several challenges why it's not really getting where we want. I think one is we have to be clear, adoption is a challenge. We need a certain infrastructure. If you talk about digital pathology, labs are not always equipped. And then if they need the equipment, they need to understand what's going to be their return on investment when they invest such a large money for the infrastructure. So that's one. So adoption is clearly not there yet. We need to build a much larger portfolio of solutions so that it's going to be worth the investment for labs. That's the feedback we got. Second, for sure, on those solutions, I think, as I said, in some rare disease, we struggle to get data. And even the data you get is not always in the format you need. And let's face it, regulation. We worked hand in hand with the regulators on we asked for a breakthrough design for some of the solution. So I think there's a potential there, but still it takes really a long journey to get there. So it's a mix, I guess, but we're gonna eventually get there. It's just gonna take more time. So I think it still holds a huge promise of efficiency for me.
Are there areas in the world where it goes faster? If you're ill, that you go to that area in the world because there's a faster adoption, or is this in general not there yet?
I would say we're not at the ultimate state, but you do have specific countries that are much faster advanced. And let's stay in Europe, don't go too far away. Let's look at the Nordics. Norway, Sweden, Finland, Denmark. About over a decade ago, you didn't talk there anymore about how can we digitize hospitals. The entire leadership, the ministries of health already had a viewpoint on we have to do population health management. And now they are seeing the fruits of that early work, right? But then you have other countries where it's still all about, okay, trying to wrap your heads around how can you make a health facility much more effective and efficient. And if we look at the technology gap that we do see in healthcare, sometimes with decades-old technology, but then the people that are actually working in healthcare, guess what? They are not living in the past anymore, right? So there is a mismatch, and we have to bridge that gap. You do have other countries which are much faster advanced, where you might have a different experience when it comes to the healthcare provision. That being said, maybe back to what Safia said, is you do have a lot of data silos still. These data silos need to be broken down. It is linked back to regulation as well. Currently, we are trying maybe a little bit too hard to over-regulate the data flow, the data governance. Don't get me wrong, right? Privacy is key, data governance is key. We can't toy around with patients' lives. Absolutely not. But at the same time, we maybe have to look at it from a different vantage point.
Yeah.
Right now we have, in some jurisdictions, people that are trying to regulate AI that are maybe not fully equipped with the capabilities of AI, and thus over-regulate, versus maybe looking at it the other way around. We should penalize the ones that are misusing it. Think about an insurance company. If they were to utilize data that they obtained that way for their underwriting, to scrutinize some of their members in whatever shape or form, and they're going to lose their license if they were to do that. What's their interest to do that, right? None. So you really have to look at how can you find a good balance between making sure that you protect the privacy, but at the same time enable innovation to advance in healthcare. And for that, you need structured and curated data to train algorithms to gain the insights.
Yeah.
And let's also be very, very honest here with the technology. It's not the solution. It is there to augment whatever we are trying to do in healthcare and not to replace.
Yeah. So in the end, it's also a fusion of different data points and then simulate potential outcomes, right?
100%.
But so it's technically, it could be my responsibility what I do with my data, right?
Who should own the data? Back to you, Max, right? Should it be you? Should it be the doctors you're going to, the hospital? Should it be the government?
Depends how much I pay, I guess.
Well, it's a very important point. But Max, honestly, if you, I mean, realistically, it's your health, your data, right?
Yeah.
So why shouldn't you participate also on some form of monetization of your data?
Like marketing, they did it as well, right? Did you provide data from yourself? Yeah.
I just want to add on one element, which is for me trust. I think you need to build that trust, because if you own the data, or you let your doctor own the data, or the hospital, you have to establish this trust. And I think with all what's going on and the cases we have, it's hard to gain the trust from the patient. So that's something I guess we still need to work on.
Except for you have a patient in a, let's call it, in a situation where it's basically between life or death.
Yeah.
And the decision is very, very simple in that respect.
That's
you
true.
want to try everything to somehow have a chance to survive.
Absolutely.
So we have, this is where we've seen in the past some models where it was an optional opt-out, and all of a sudden people were like, no, we're not going to do that, versus an optional opt-in. So what is really working more? What is working less? And we have to maybe try a couple of things and maybe a few more times to get to a point where we can really create the results and the impact.
Okay, I mean, just coming back to that, I mean, the friends of mine were also involved in this imaging part for 10 years ago already. And since then, it's not standard. So I recently did a full checkup, and there was a machine with a floppy disk. I haven't seen it for really a while, and it was in Zurich, Switzerland, and it was not an old clinic. So it was actually very surprising. Honestly, it was really. And the person who used the floppy disk was much younger, so she even didn't really know how to use that. I had the impression this is how it was saved and then printed out. No, but and on the other side, you talk about the trust, but I mean, we have technologies. I mean, in the end, it's about AI, personal data, and maybe storage, a blockchain solution. It is technically all there, right? So you have everything ready on a technical point of view to do that, right? Or at least when you look into different business models outside of healthcare, you probably could see what is going on there already.
Absolutely. And if we were to look at the two areas of our life that might be most precious to us, financials and our health, right? Somehow we trust the financial system with that information. No matter where we are in the world, we can use our credit cards and so on and so forth. We believe the right safeguards are in place. We are not super worried about credit card fraud or whatever else. And data, by the way, around the world flows. Yes, you still have some different systems, but somehow they communicate. And then you look at healthcare, and we are now all in Switzerland right now. If I want to have now access to all my health information, despite that I work in health tech, I'm struggling severely. Yeah. And that is an issue.
Yeah, that's true, to get it together in different formats, as you said that. So, okay. I mean, just coming back to the market, what is currently the hottest thing? What is the trend where you really see where money is flowing in? Maybe 2-3 applications Michael, you've seen, or where your company is looking into, or what you see on the market?
Well, we are quite fortunate that we are with Caresyntax in a field that is seen as rather hot. Obviously because of the total addressable market of surgical technology, but then at the same time of AI. So AI in healthcare, you very swiftly get into the fields where can you really generate a lot of returns as well. Mm-hmm. And if we look at the last evolutions of technology that we had and what we are now facing with AI, how it is advancing, it is phenomenal. We basically have the iPhone moment all over again, right? But at a much bigger scale. Okay. And I do see a massive potential of AI in healthcare. You see the investor interest is shifting again. Now, Q4 last year, you saw a lot of big deals already happening again, particularly in AI in healthcare. Mm-hmm. And that is a broader place, obviously, but in general, AI is one of the key aspects that I do see. Safia?
No, I'll just build on that because you're absolutely right. For me, from more therapeutical area, I would say huge market and need in the NCD, non-communicable disease. We know all the cardiometabolic area is huge market because I'm talking about market because I see how companies are all going crazy and trying to find a new GLP-1 and that's crazy. But I think what worries me is like before getting all those patients, and we touched on that, we desperately need to do something to avoid having those patients ending up in diabetes, right? And I think prevention, so digital health on the prevention is something really which for me has a huge potential. And also I've seen a huge interest from investment and innovation and also in the pharma players. And I've touched, of course, on the imaging area. I would say maybe to be specific, the multimodality solution, because I've seen a great solution in radiology, genomic testing, digital pathology. But when you combine all this and do really a multimodality solution, you get really interesting biomarkers that are very more precise and in terms of what you're searching for. And I think it's probably for me also the future.
To add to that, one vertical that seems to be growing a little bit faster, or maybe much faster than the others in the broader AI and healthcare realm, are the entities that manage to capture and curate and structure the data as part of their business model to then enable additional use cases. Because a key challenge that has been faced in the past is a lot of great AI companies severely struggling to even get the data to train their algorithms, have to pay a lot of money to get that. Yeah. And that was one of the biggest challenges. So if you have entities that do have as part of their core business value creation for one player, multiple players in the healthcare ecosystem, as part of that are structuring and curating the data to then leverage technology, AI, for additional use cases, real-world data, real-world evidence. Yeah. That is really growing much faster.
Okay. I mean, we are here at the WEF. There's a lot of different people from the world are here. There's also globally a couple of tensions. And also there's an impact on the innovation because there's also the wider, let's say, the conflicts are going. Then there's maybe in AI or data is also, let's say, a difficult topic. Is this in favor or against innovation at the moment? Michael is already ready and wanted to give you the first floor.
Oh, wow, yes, we live in very special times right now, I have to say. Few things coming to my mind, but I guess I mean, I will not tell you that this is really playing in favor of innovation, because I'm a true believer that innovation requires a diverse set of talents. Mm-hmm. And when I hear CEO of major companies saying that we should go back and dismantle all the D&I efforts that we were doing so far, or that we have to go back to this masculine power, I'm a little bit worried because everything is, sometimes we take things for granted in terms of diversity, and we see that we should not. All the efforts invested now seem to be really behind. So I'm rather worried, but of course I'm always optimistic, and I truly believe that people will react to that, and we will not let this really be the direction, hopefully, because they're setting a certain tone. I hope we're going to really come over that. So, and yes.
It is hindering innovation to some degree, though I also see a shift in viewpoints, that we are not necessarily looking at one specific vertical anymore, but the boundaries are blurring. So technologies and approaches that worked, for example, in logistics, that worked in financial services, that worked in other parts or other industries, due to the convergence of what we see in the broader healthcare realm happening, are now entering that space. Yes, it was maybe kickstarted a little bit with the COVID pandemic. Thankfully, that is in quotes relatively behind us. And we saw the pendulum swing back to the other extreme again, right? I want to do it the same way like in the old days. But now we see more and more of these novel approaches are actually being adopted, and new innovations are actually being created due to this openness that maybe was forced to some degree, but it actually changed how some people are looking at it. Yes, I do see challenges, but at the same time, like Safia, I see also a lot of opportunities. And that is exciting, and particularly in this place like Davos, where you have bright people coming together, and maybe sometimes crazy ideas are being discussed. Yes. At the same time, you also see some of these crazy ideas coming to fruition. And this is, I think, what we are here for.
Okay, so quick question concerning the Middle East. Is this playing a new role, Michael, then in the global financing of healthcare due to a more neutral role?
I do think that the Middle East is continuing to increase its importance in the world. In a lot of instances as a mediator, in a lot of instances as a neutral place that brings innovation together. I'm based out of the UAE for now 13 years. And if I just look at the diversity we have in the country and everybody living together peacefully and really working on a lot of innovative things, it is phenomenal. In addition to that, if you look at UAE, if you look at Saudi, if you look at Qatar, and the visions that were put in place by the leadership, where these countries were 30, 50 years ago, where they are today, it is a phenomenal evolution. And that is maybe second to none in the world. We haven't seen that. So I do believe that will continue. I also see a lot of not only capital flowing to the Middle East, but you have extremely experienced and successful investors from the Middle East. Abu Dhabi is the capital of capital. Why is that, right? And that is not necessarily because a lot of external money flew in, but it's because of very talented people that did a lot of great investment decisions, built up ecosystems, and invested into the right things. So I do believe that will continue at a much faster pace than we have seen in the past.
Quote, any comment from you on that? I mean, you also spent some time lately there. And
yes, for the first time, in October last year, I went to Riyadh and spent 2 weeks. And I've met a couple of key stakeholders, especially in the health tech sector. I was just blown away, honestly, to see the willingness, the huge space for innovation. Funds are there, but I think what I realize is also they're willing to collaborate a lot with the other countries to bring really the innovation, the expertise, and address some of the specific challenges they have in their country.
Yeah.
For example, I was not aware, but all the genomic aspect, right? Genomic testing, approach and database, huge one that they have because of different cultural aspect that we have in this country. So I wouldn't say it's the whole Middle East, but Saudi in particular was also a highlight for me. But the openness, I met, for example, the founder of a Women's Health Foundation there. They run an event, and they were looking for collaboration outside in this area to really bring basically the expertise, because they have the investments needed, but they're lacking the expertise. So I think for me that was also a call to action to say how can, as a Swiss maybe ecosystem, we can really work together bring some expertise, but also think of how to apply this also in a cultural in a different culture context, and not take what we know and play it there, because it's not going to work. We know that. Yeah. But really, this was really for me the interesting part of how can we work on that in a collaborative way, taking into account the specificity of the market.
And that coupled with very innovative governments, right? So the UAE had a Minister of AI, a decade ago? If you look at how we talked about the data flow, data governance, right? How an innovative approach to that is being enabled by the UAE government, by the Saudi government, Qatar government. That really drives a lot of the innovation forward, particularly in healthcare. And that is also drawing a lot of innovative companies in healthcare exactly to these different places, because you can do something there that you can't do that easily in Europe or the US. Yeah. And that, I think, is unique and maybe something that we all should take advantage of.
Absolutely. Do you see there more women founders or in innovation, more women or more men? Is the diversity better in these countries compared to Europe or Switzerland?
Yes,
or
specific Middle East, you mean? Or
yes, specifically in Middle East. I mean, you just talked about the event in Riyadh and also the Women Foundation you met, and also that field that was the discussion point. So what is your take on that?
Yes, so I think people have misconception of this country. I think you haven't heard this for the first time, I'm sure, but there is this misconception. People mix everything, but I've met and I know so many talented women, very senior position, and that we can really learn a lot. And they are role models. And I've seen the same, by the way, tendency in Africa, because I'm also looking very closely to Africa market, huge talent pool there. And I think, honestly, as, for example, we're talking about Switzerland, because we are three of us also from Switzerland, we can learn so much from those markets and from those women who are driving. When you see Switzerland being such a conservative country, there's so much we can learn from them. So I think I see that actually they lead the way, and I see that in Switzerland, if we don't catch up on addressing these challenges around gender equality and in general diversity in general, we're going to lose the war of talents, and we know that we desperately need more and more of those talents in specific fields. We're going to lose that because people are not staying in Switzerland anymore because of the wealthy country. They want to also, the meaning for them in terms of social impact makes also a difference, and they're willing to work in a country where social impact is also important and where we lead the way in terms of diversity. So I think it should be a wake-up call for countries like Switzerland, and not just Switzerland, Europe, some European country, to really also look at them as more leaders from that perspective.
Can you also say something about that, what you experienced there? Because I also had so many misperceptions about Middle East, about women in Saudi, and what you experienced there. Because I think that is quite valuable to get your insight from women in healthcare, in leadership positions, in startup positions, what you experienced there.
Sure, yes. And honestly, we all have biases, myself included, and I went with a certain way of thinking about Saudi. But, it was really surprising because it's one of those countries where nobody looks at you, how you're dressed. I thought, we had to be maybe covered a certain way. So at the beginning, I was covering my hair, lightly. But I realized nobody didn't care. There are groups of people, women, men, all together, and everyone is wearing something different, from the hijab to the niqab to nothing, to just Western stuff, right? And they're all hanging out together in a coffee, or it's not like people are not just, per groups. That's one thing. And then I've met really like CEOs and major stakeholders, women leader, and wearing different things. So it's not like you can say those women wearing niqab are this type of person. We like in Western Europe to put people in boxes.
Yes.
So, and it's not the case. I think, as I said, we can learn so much from this culture. So I felt very, I would say, welcome. I could just be, of course, I'm mindful about the culture. So I wouldn't say, hey, let's go as a Western person and just do it our way. So for me, it's very important also to respect that and being mindful about that. But otherwise, no, I think it was much more open mind that maybe what people would think and expect.
Yeah, I do agree. What is your male position on that?
I wholeheartedly agree to that. We have incredibly talented, experienced women leaders, be it on the public sector as well as in the private sector and startups, and on the investment side across the entire Middle East. And that is just continuing to grow. And in a lot of instances, particularly if you were to look actually at the investment side, female leaders are to some degree maybe the better investors, right, than us men. Because sometimes we might get too excited about something and are not having the patience to effectively evaluate. And I think it's really needed. And back to what Safia said, in some instances, it's very much a role model, and we should very closely look into that.
Yeah. Absolutely. No, it's great. I mean, I think you have also a lot of formats here in Davos at the World of Women Foundation. I think that's quite amazing also what's happening there. So maybe we should close what's the future vision in healthcare. So what do you see the healthcare in 10 years? Is the data combined? Will we have automatic checkups? Will the phone tell me, Max, it's over, you go home now? For prevention reasons, or what is your perspective for short one and yours?
Well, I think we will get more and more into the continuous proactive management of our health, life and well-being. We already see a lot of us are wearing fitness trackers. I see you have a smartwatch as well. And we will have more and more implants in our body that are constantly measuring, monitoring, and maybe even preventing or dispensing medicine, whatever else, if something is being identified. I do see that for sure happening. I also do see that health facilities will change, so that we will have, I would say, hospitals for different purposes, I think more complex cases. And a lot of the other procedures will be maybe done in the comfort of our home. I also do see that technology is continuing to advance. People will be much more comfortable for, let's say, the general stuff, in quotes, that we have in healthcare to interact maybe with a machine, some sort of technology rather than human being. When it gets to the more complex cases, right, you still want to have the human touch, don't get me wrong. And that is clear, right? Empathy, time, attention is what we then want. But you have a runny nose, you might have a rash. Well, guess what? If I have the choice between getting immediate feedback from an AI that most likely has a much broader experience than any doctor ever can, because it utilizes data points from around the world from millions and millions of patients, and I can get that now, I have to wait a day, a week, a month to get it from a practitioner, I definitely want to use technology. So I think that will massively advance, and we hopefully will catch a lot of diseases much earlier. The sensitivity, specificity of a lot of these approaches is continuously to increase, with that building up the trust, and with that getting higher adoption. So I think a bright future ahead of us. It will be a rocky road to get there, don't get me wrong, but we all in healthcare are passionate about what we do, and that is why we are in healthcare. We have to continue to push the boundaries.
Absolutely, thank you. Safia, what's
So, building on that was pretty exhaustive, though. Thank you for sharing, Michael. I would say just to build on that and not to repeat, because I fully echo what Michael has shared. I would say we need to keep in mind some of those key trends, right? We have a huge shortage of healthcare workforce, which is forcing us to do things differently. And you can hardly go and get a doctor's appointment to do just a regular check. So we definitely need to overcome that through, to your point, using technology to help us monitor some of those general metrics, like the data points, to make sure we do more prevention. I also think that prevention, but also ownership. I think people in general will start to also realize they own their health, right? They are accountable for their health, and they need to take proactive action, keeping healthy. And I think this also represents a huge out-of-pocket that people are ready to put for their health, because you can enjoy a restaurant, you are paying for a car, whatever, but people are also realizing that they can also pay out of their pocket for their keeping in a good health.
Yeah.
So
Absolutely.
for me, those are some of the trends are interesting, which open up a huge opportunity to push again to this more prevention than curing people too late.
Yeah. Thank you very much for that. And with this, I would close and wish you a good week in Davos. And thanks again for your insights.
Thanks for having us, Max.
Thank you.
Thank you.
Thank you very much.
Thank you.